Okay. All right, welcome everybody. Let's start with the pledge, and then I think Tim's here.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Tim, you want to multitask?
Good afternoon, everyone. Let us join together in a word of prayer. Gracious God, you have a good sense of humor in that it was dry until we got in our cars to come this way. So we laugh at the things that give us joy and that give our hearts warmth. Continue to guide us as we continue to listen to the story of Sherry Health and find ways to use our hands to connect and make this world a brighter and better place. We pray all this in your holy name. Amen. Amen.
All right, let's have some lunch.
Yes, there's a
Right. Okay. Does this work? Is that working?
It is a little louder.
All right, I'm gonna rattle through some announcements before our distinguished speaker. First off, I just wanted to list some events that are coming up here in October and offer to let anybody talk about them if they like. October 10th is Crafting Vision. I don't know if you want to say anything there, Tim. I'm guessing tickets are still available and
Tickets are available. Please come.
okay.
Silent auction.
Silent auction.
How do we get tickets?
Okay, good.
How do we get
How
tickets?
do you get tickets? You can see me afterwards, or the best way is just to go online, abdimi.org, and then register there.
Perfect, thank you. October 15th, our next meeting, we're doing a guest day. I thought I saw John. Oh, there's John. John, you got anything else to add to that?
Yes, sir. Free guests. Next time we meet, so in 2 weeks, you can bring guests anytime. You do not have to wait until the 15th to bring guests. But you would like, sometimes guests are more comfortable when there are other new people in the room. So that's the idea behind having a guest day a few times a year. And so during that meeting, we'll also have a presentation from the Lions All-State Band. So it'll be a nice opportunity to kind of showcase one of our projects as a state and at the same time introduce guests. So please feel free to bring them. No charge for guests, just bring them on over. We do want to RSVP. By next week. So get your guests in. You can just tell me who's coming and I'll get the numbers to Cheryl.
Great, thanks, John. I also have October 23rd, Cherry Health Celebration. Maybe Megan's gonna talk about that during. Okay, perfect. Couple other notes, you guys probably saw, but they're doing a tree planting campaign again for the district. If you're interested in getting some trees for free, I need to email Julie or Michael at the district level to get those, and then you can pick them up at Projects Night, which is October 17th, or have a friend pick them up. Projects Night on October 17th, perhaps. I know we've got a date for the kids' holiday shopping, December 7th. Ann, do you want to add anything to that, or Don? Yeah, microphone if you want.
I think just about everybody here, there's a couple of you who have not participated in the holiday shopping event. It's always the first Saturday in December, so we don't have snow. Don is the co-chair, and we couldn't do it without each other, right, Don?
Right.
And we also have a lot of help with volunteers, and you guys were phenomenal last year. I got a call yesterday from Kelly Ellis, who is our collaborative partner with the Base Camp Ministries, and they already have the kids just ready to go. 50 of them. So we had 49 last year. believe it or not, and it felt like it didn't. So for those of you who don't know what it is, I'm gonna give John this little synopsis to put in the Nuda, but it's 50%, 50 of the kids that, each, they come and they shop for their family, not for themselves. And about 35% of them are visually impaired. So we collaborate also with the Grand Rapids Public Schools and their visually impaired program. And then 65% are the center-based kids who are from center-based camp. And, you know, parents bring their kids, drop them off. The purpose of the event again is for the kids to have an opportunity to purchase gifts for their families. And because of economic reasons, they all are, you know, they have to be referred. It wouldn't be realistic for parents to provide this. It just isn't. So, so prior to shopping, the kids have an opportunity to make a list. They come well prepared. Those of you who've done it before know we have a pretty well organized, I think. And, you know, they come well prepared. They have the sizes, the names, everything else that, you know, and they get $100 gift card from us. Myers contributes $15 per child. We contribute the rest. There is a grant that's written every year, and that is through Myers, or we submit that. We've already submitted that. So what else, Tom?
Well, we just like to pass this box around, and if anybody would like to contribute, that'll help take care of one more kid maybe, or two more kids. So I'll start that over here.
And if I'm not here, Don will be here to, at the next, we only have three more meetings. So we need all your help. We need the volunteers. It's one morning out of the whole year, 7:30 to 10:30. I think you'll find it very rewarding. And I can hear the Christmas bells ringing already. So we'll sign. Yes.
If you don't have cash or your checkbook, what should you do?
Yeah, I'm thinking the same thing. I just told Gary we need to keep our code on everything.
You can,
Who's working on that?
yeah, there'll be
You
two
have
more,
Then,
there'll be three more meetings at least, so.
Yeah, there's 3 more meetings. Yeah. There's 15th of October, there's the 1st of November, and then the next one in November. And then, you know, so we're hoping to get enough volunteers. Some of you know, you all will get a confirmation email a few days before the event. You get a confirmation email with a detailed description of what to do and where to go. It's easy, right?
Yes, and you could also have your spouses or adult children
Yeah.
work with you too, because we really need the people.
Oh,
Spouse says?
spouses,
More than one?
adult children, yeah,
Maybe not at the same time.
yeah. And they would rather have some of the younger people than us old folks, so, you know, but anybody that, and you get donuts, coffee, and, you know, sit down and relax.
enjoy.
Yeah, yeah. So John will probably put something in.
Yeah, we'll get in there.
Okay, thank you.
Thanks. Did I miss anything? Is there anything else, any other news for the good of the club? Oh, yes, I'm sorry. I was gonna make an announcement. I think I talked to you a lot about this, but, so the parking, they're working on the parking system. They are not going to give you a ticket, and if they do, let us know, don't pay it. But they said they're not policing it right now. They're working on a new system where theoretically at the next meeting, when you pull in, you're gonna get a ticket. You're gonna bring it in here and get it validated here at the meeting. So that's going to be the system going forward. They've been working on these upgrades and apparently they didn't hit the October 1 deadline. So, appreciate your patience with that, continued patience with that. That's all I've got on my list. Kelly? Yeah.
October 15th, the kids' food basket, 6 to 7:30.
Thank you for that.
Text or call Cheryl.
Text or call Cheryl.
Sure.
Cheryl.
Kelly, what time is that again? What time?
6
6.
o'clock.
6.
And kids food basket.
6 on the 15th at Kids Food Basket. Somebody else, Kim?
Couple of us been working on the holiday, party. December 14th, Saturday, at Blythefield Country Club. But we'll get more details as we develop.
Perfect, and if anybody didn't hear, December 14th, Blythefield Country Club is tentatively our holiday party. And that's where we'll do the raffle. I think we decided, Rob, Kim, we're doing the raffle at that party, okay.
Assuming Ryan's, we'll raffle the stuff off, assuming Ryan.
Right.
is still willing to pull out.
Okay, any other announcements? Otherwise, I'll turn it over to the tail twister. Okay,
Okay.
You want the microphone?
No, I wander around, I wave the camera, so, but I think you can hear me. Anyways, to start off. The look around has been pretty good on the pin for most everybody, unless, somebody wants to tell me that they don't have their pin on. Oh, you should have one on every suit that you wear.
I do, it's the best. Not on the vest.
Not on the vest, you didn't come fully dressed today, that's it. Okay, yeah, oh, good, I like it when people give me money. Anybody else that, going to admit to not having their pin? Okay, that's, next, let's go to Happy Bucks. Who has something that they want to tell us about? They just had a good time. Did you put your hand up there?
yeah, I gotta have. The Lions had a big win last night, and in about 2 hours, the Detroit Tigers play their first playoff game in 10 years.
And they have a triple play.
Oh,
Man,
gosh, it's been
man.
fun to watch the last.
Okay.
Good to see you, you're monitoring.
Oh, nice. And Scott,
This is a minor expense that I fear, but if my wife will tolerate me for 2 more days, we will make 50 years on Friday.
And he's gonna be winning golfing Friday.
Oh,
Maybe.
yeah.
Wait a minute,
Okay.
I wasn't gonna do that, but since Scott already did, I won't be here for the next meeting because 55 years. And it's my birthday. On my birthday. It's 5 years on my birthday.
Yeah, that's a really
He is
good
a
plan
saint.
by, Jim.
He is
Yeah,
a
bad
saint.
plan.
I would forget 2 things on one day.
Oh, looks like Gary's got some money for me. This is a good day.
So I just spent a week down in the Virgin Islands, invited down there by our friend Lion Justin Faber, who I'll introduce as a guest in a moment, but, had a great time, catching some fish, deep sea fishing, barracuda and a bunch of other smaller ones.
I caught a bird.
Tuna, Cheryl caught a seagull.
Oh.
Because the seagull came in to get her bait, okay, took the bait and flew off. Okay? She was trying to really, she yanked it away, so we got it all on video, so that'll be posted. The best part
Seagull being
was,
called flying car, you know.
There you go.
swimming with the sharks.
Yeah.
So, you might have seen that post on Facebook, but, something I always wanted to do, so even got Justin down there with me, Cheryl stayed in the boat. And,
I'm not
Smart
down.
girl.
they're not too big, they're nurse sharks and reef sharks, so their biggest is like 7 foot long or something. But you have to go out there and you have to hold on to a rope in the water, we weren't in a cage. So we're out there, and as we pulled up to the spot and they threw an anchor down, all of a sudden the sharks are swimming around like, okay, it's feeding time, right? They throw a rope out and you hold on to the rope with your hands, because if you put your hands out, like swimming, they think that's bait, they'll take your arm off.
One of us did not follow directions, I guess.
That was only for a few seconds. We'll have the video, they took a video and they're sending that to us underwater, but it was a great experience. Sharks just come and swim up to you, you have to put your fin up, and they have sonar, so the sonar bounces off the fin, and then they turn around. So if you just wave at them, they think that they're gonna bite you, so you don't wave at them.
And there are no great whites in the Virgin Islands.
Yeah, so it was interesting, and,
Well, I've got Happy Buck also, just got back, last week, went out to see our daughter in Portland. Had a nice 5 days with her. Last day was, a lot of the first days were do project stuff and all of that. The last day we were up at Trillium Lake, where we laid out on sort of on our kayaks and our paddleboard, looking up to Mount Hood.
Oh,
Beautiful, beautiful place. So, very cool. Any other happy bucks? This is a pretty happy crowd, you know, you should be in great shape, no problem, everybody's happy. So, yes.
So, as I said, Ryan Justin Faber, who was also a past international director, served on the International Board of Lions 2019 to 22. Now that's 3 years. Now, the normal term for an international director is 2 years. But that class was remedial, so they kept him on for another year. Actually, that COVID delayed everything, and they didn't get to for a full year. We didn't get to do much. He was the chair of the leadership committee worldwide. Did a phenomenal job, and is a great young leader in our state and in the country and the world. So we took him on a vision mission with us. He was with us in Suriname with our team last spring. And he's a multi-talented guy. He'll tell you that he's just a carny. So a month ago, we were up with him in Houghton, Michigan, cutting French fries and making corn dogs, and what was my specialty? Cheese curds, right? So he does that in the summer, and he manages properties, and I'm gonna give him 15 seconds to tell anything else about himself. And he's this far away from getting his PhD in a title that's way too long, but he can tell you what it is.
Just proud to be a Lion and proud to be here. It's always a blessing to be amongst family, and I grew up in the Thumb area. I don't know if you mentioned that or not. So we're pretty tight knit over there. There's not a whole lot of people, but the biggest export we have is teenagers, unfortunately. So, good to go here in this side of the state and see where they all go. So thank you for having me.
Okay, then we got the raffle. And. Okay. So. Let's see. We have our raffle to match up to the tickets and. I know something. Yeah, you can hold this bag. Yes, tried to before. You can even hold the white chips. Yeah. Okay, everybody sees it. Went in. Okay, we're gonna draw 2 tickets. The first ticket gets $5. The second one gets the opportunity to draw the white chip out of there, which has accumulated funds over the last number of weeks and months. We're not at a year, but anyways. And speaker. First one.
Okay. The last 3 on it are 690.
Bingo.
Oh, Justin.
You took all my money.
I
Okay, and the second one will have
actually does come out of the raffle.
the winner and a
Chance I win twice. If you pull 691, you're out.
me, okay. Last 3 numbers are 806. 806.
Oh, yeah.
Jeff Cry again? What does he put on his ticket?
He's a numbers guy.
I've been playing a lot of golf bets. Golf bet. I could use
Oh,
That's too bad.
yeah.
Okay. With that, do you want to introduce Megan or shall I? Our speaker today is one of our own, Dr. Meagan Baker. She is the Director of Vision Services at Cherry Health. I guess without further ado, let's let Megan have it.
Now I don't have to introduce myself, but yeah, Megan Baker, I'm the Director of Vision Services at Cherry Health. I am an optometrist by training. I have been there since 2011. I've been in this role for about 2 years and I'm a member of this club, so proud to be a lion. I'm gonna talk a little bit today about Cherry Health in general, as well as kind of tune into what we're doing in vision services as it relates to how we're expanding services and our team. So we'll get to it, but Cherry Health is one of the largest federally qualified health centers in the state. We are located primarily in Grand Rapids, but have locations across the state. We employ over 700 healthcare professionals and deliver comprehensive, high-quality health services, including vision services, to underserved communities regardless of their insurance status or their ability to pay. We are an integrated nonprofit health system, so in addition to vision, we offer primary care, pediatrics, behavioral health, pharmacy services, and dental and more. So patients can get almost any primary care or behavioral health service that they need within Cherry Health. The mission of Cherry Health is to improve the health and wellness of individuals by providing comprehensive primary and behavioral health care. Vision services falls under our primary health care, while encouraging access to those who are underserved. Our vision is that our community, mainly in Grand Rapids, will be healthier because we seek out and welcome those who need our services. All will be treated as family with integrated, coordinated care to improve health and personal well-being. This is got a lot on it, but I'll highlight the important pieces here. This is what we did as an agency in 2023. We served almost 60,000 individuals. We had a 97% patient satisfaction rate. In vision, we had 23,274 encounters. That is examinations and glasses combined. 69% of our patients identify as people of color, which means they selected anything other than non-Hispanic white. 26% of our patients speak a language other than English. And 95% of our patients are at or below 200% of the poverty line. To put that in perspective, 74% are at or below 100% of the poverty level. And that in 2023 was $30,000 for a family of 3. To help address the financial burden of healthcare, we do have a sliding fee program. Patients with or without insurance can enroll in our sliding fee program, where they get a discount that is dependent on their family size and their income. This unreimbursed care is made possible by federal grants and by enhanced Medicaid reimbursements largely. We do employ a health insurance assistance team, which can explore options for health insurance with uninsured patients and help them enroll, which we have a lot of access to the program, especially because Medicaid went through a redetermination. During COVID, everyone just stayed enrolled. That ended, and now a lot of people need help either getting re-enrolled with Medicaid or finding other plans. As it relates to vision, this has been the core of our team for some time. So myself, Dr. Whitcomb runs our residency, Dr. Fox handles our interns, Dr. Boss and Dr. Mayorga. However, I am happy to say we are continuing to grow. So this is Dr. Hannah Grabowski. She was our resident last year. She just returned as a full-time clinician. And in a couple of weeks, Dr. Tim Borges will be joining our team as well. We are growing because we are expanding. So it's time we're finally kind of recovered from that post-COVID dip. So some of the new things that we are doing, in the last couple of years, we launched diabetic teleretinal imaging. We put 5 retinal cameras in medical sites. The medical assistants chart, prep, and look for patients who have no evidence of having a diabetic eye exam in the last 12 months. They image those patients at the medical site. Then they schedule a telehealth visit with one of our optometrists. Those doctors read the images, they review the images on video with the patient, they give patient education, they determine when the patient needs an in-office follow-up, or, and this is definitely happening, we are stumbling on people that need ophthalmology referral. And so we will coordinate that as well. The cameras are taking great images. I'll show you a couple in a minute. And they're doing it through an undilated pupil, which might not mean a lot to everybody, but Gary will understand when he sees the photos. But it has really improved our adherence with our diabetic measure. We've gone from 58% to 74% of our patients that we've got evidence that they've had their diabetic, like a diabetic eye exam or screening of some point, at some point. I think we're the second, like our percentage is the second in the state as far as health centers go. So this program has definitely made an impact. And in addition to diabetes, we're stumbling on macular degeneration, glaucoma, optic atrophy, retinal detachments, things like that. So we are finding a lot of really visually detrimental ocular disease. So these are both diabetic retinopathy. Again, these are great photos. They were taken through an undilated pupil. These are patients who may or may not have access to our vision care or anywhere else. So it is helping capture and kind of fill a gap in care for folks. Yes.
Show them how much normally a view would be through a, you know, if somebody looks in the apple. You know,
Like with a lens?
yeah, right, with just a.
Yeah. Well, yeah, so if you're looking in the eye by itself, you're gonna, you know, use a lens to scan each of these areas. You're never gonna see the whole thing all at once. And so honestly, we have a camera similar to this in our clinic. We take photos of all of our patients with diabetes because you will capture things on a photo you don't capture on your exam because you're scanning small areas at a time. Patient cooperation can be challenging also, just as far, you know, people don't love looking at the bright lights. But I mean, these are taking fantastic images. So these are like spots of blood from diabetes. This is diabetic exudate, which causes diabetic macular edema, which is the most common reason for vision impairment in patients with diabetes. These are cotton wool spots, which are they're retinal infarcts. So almost like a tiny stroke in that area where that retina is not getting enough oxygen from the diabetes and it's swelling up. Some of this we can monitor, but some of it, you know, this, especially if it was a little closer to the line of sight, that's got to go out. And so some of this stuff we're capturing, they're skipping a visit with us and they're going straight to get ophthalmology care that they need. So it's been a really impactful program, and it doesn't necessarily replace their comprehensive eye exams, but this has been a heck of a lot better than no eye care at all, which is what some of these patients would have experienced. We've got 5 of these cameras out. We're deploying an additional camera this fall and possibly another one later in the year. We did also purchase a mobile vision clinic. We purchased this from Southern College of Optometry, and we were able to do some minimal repairs. It didn't need much. We were able to rewrap the vehicle. It has 2 complete lanes of equipment. We have a retinal camera, auto refractor, and retail on there. So you can do glasses and things like that right off of this RV, basically. In the summer months, we took this RV around to sites in Grand Rapids as well as down in Berry County that don't have vision. We took care of 360 patients with comprehensive dilated exams. We provided glasses to them, which they could then pick up at their home health center, or we could mail them to Berry as needed. Right now it's being used in our school vision program as it will be during the academic year. It was an interesting thing to do because we took this RV, it's big, to a couple sites that are very, very close to a part of the city where the Grand Rapids Lions Vision Clinic is located. And even clinics a few miles away, we had patients that said, I'm so glad that this is here. I don't want to come down there. I want to come where I see my medical doctor. I want to come where I see my dentist. Even clinics that were just within miles of us. So it was interesting to hear and a little bit surprising to me, actually. Seed to Succeed is our school-based program. This is another reason we're onboarding optometrists. We have re-partnered with Grand Rapids Public Schools. Grand Rapids Public Schools is a large district. Ultimately, this is expected to double our program size and our need in the school. And we're happy to be back because those kids do need the eye care. And again, with our school program, we go in, complete dilated eye exams, the kids pick the glasses are dispensed at the school. This does not cost the children or families anything. If they have insurance, we will bill the insurance. If they are uninsured, it is all free of cost. So to accommodate this district, we did expand our team, which I shared earlier. And one of them is operating on the RV, the other one, we have mobile equipment that we move in and out of school. However, this did come with some significant upfront costs, but fortunately, we had some federal grant funding that is really allowing for the expansion and the purchase of a lot of this equipment, so. As far as the kind of last year goes, just as a summary of what we've accomplished, in total, we did 12,000, little over 12,000 examinations across all sites. The largest, of course, being at Heart of the City, where the Grand Rapids Lions Club Vision Clinic is. We did introduce same-day access, saw about 600 patients that way, which they love. They call in the morning, they get in that day. It's a limited offering. We try to make sure that they are filled, but patient loses their glasses, patient gets an infection, they can get in that day. And then the diabetic virtual visits, in that year, we did about 350 of those. For glasses, we ordered 10,253 pairs of glasses in the year. And as far as the funding from the Lions, which we all care about, is very important, around $9,000 of that was applied to unreimbursed care. A lot of that in the school, not all of it. And we did purchase a corneal topographer with Lions funds after approval. This is going to be an important instrument for us looking ahead, because in early 2025, we are going to begin contact lens fitting, both routine and specialty lenses, which you need a corneal topographer to do. It's a service that most health centers offer that we have not to this point. But after a recent audit and just learning some information, it does look like something that we are going to be able to move forward. In addition to that, we are going to start, most likely going to start being able to care for our employees. Up to this point, they've had VSP, which is a vision plan that doesn't credential health centers like us. We're moving our employees to iMed so that we can take care of them and their families. So hopefully that will amount to even some additional growth. In kind of closing here, the Cherry Health Celebration is coming up. It is at Frederick Meyer Garden on October 23rd. I put some information on the tables. There is $125 per ticket. The tables have 10 seats. I'd love to see one full of Lions. That would be fantastic. You can buy tickets online, you can use the QR code, and I think I put a couple things on the table where you can actually mail in a check. Anna's here today, so if you have other questions, she's the one. In closing, I want to thank everybody, and everybody's kind of a familiar face to me now, for the ongoing support from this club. I have been around long enough. I started when the new clinic was opened, so I know that the impact that this club has had on Cherry Health, and I hope to keep this relationship going forward. Questions for me?
You mentioned at the beginning, I think it was like 53,000 people that had been helped, but 23,000 were through.
So duplicates. So because those are retail too. So so if you have a patient that gets an exam and glasses, it's gonna be double. Yeah, because we did about, and then the next year, it's about 12 to 13,000 actually encounters and like 10,000 pairs of glasses. Yeah. Oh, wait, yeah, another question now.
What kind of waiting period did they have to get into the clinic?
That's another reason we're expanding. So our wait times were getting wild. Like we track it by third next available, which is the third available appointment a clinician has to kind of access. And we were getting out near like 57 days, business days. So I'm trying to get it down to 14. Right now we're in the 30-ish days to get in. In Montcalm, you can get in immediately. But at Heart of the City, we got backed up. So that's another reason we're bringing that I was able to support hiring more than one doctor here. So we're gonna onboard 2 of these people quickly to try to bring these times down, because wait times have been a major issue.
You did say same-day appointments are available.
Yes, they're limited, but we do tell patients too, if they're upset about the wait time, the staff is educated to tell them, just call in the morning. Call in the morning tomorrow, call in the morning next day, you could probably get a same-day appointment. So we're doing a patient education piece to that as well. If the demand for those increases, we'll increase the number of those that we have. But so they can get same-day access, and of course, if they call and they have an emergency, they have a red eye, they have flashes and floaters, we squeeze them in. We help tell them to come in, we squeeze them in when a patient no-shows, which unfortunately is frequent. And so if it's an emergency, then we'll take care of them. Yes.
You have, mentioned referral to an ophthalmologist, is that person in-house?
No. We do not have any in-house ophthalmology. We do, for patients that are uninsured, it is a problem because some subspecialty ophthalmology care, you just don't have a choice. If you access ophthalmology care in the hospital system, so we use, it's U of M now, but what used to be Metro, they have ophthalmology. Those patients can apply for like a discounts type sliding scale sort of program through the hospital system to access ophthalmology. He doesn't do retina care though. So we are fortunate. We have a great retina practice. They are conscientious of patients' financial burden. And I will see a lot of the patients we send, if they need an injection, they'll use a sample. They'll try to keep the costs down.
In your services in general, yes, there is a particular population, but available to all.
It is available to all. We do take most insurances, but not all. And so some of these commercial vision plans we do not par with. And so those folks would probably be better served going elsewhere that does take their insurance. But we do take almost all commercial medical insurance. So any Medicare plans, Priority Health, Blue Cross. So if there's a medical need for an exam, we could see patients. And that's the other thing. With vision, it's different than dental. If there's a medical eye problem, so if a patient has diabetic retinopathy, has glaucoma, has cataract, that examination is going to be billed to their medical insurance. If a patient comes in for a routine exam and ultimately just needs glasses, that will go to a vision plan if they have it. And so you don't always know that ahead of time though, how that is going to go.
Don't go away. So the history, many of you know it, but 20 years ago, Cherry Health was a little office up on Cherry.
550 Cherry. And I was there too as a student, third and fourth year. So I've really been around since like 2008.
Yeah, and I was there 20 years ago, and there was 4 of us that volunteered 1 day a month to do eye exams in the clinic. And we had 1 exam room then. And it was pretty, I think we had 1 staff member, maybe 1.5, and a little bit of optical. So if you think of 4 docs, each working that's 4 doctor days a month up there. And then Dr. Lillian came in, and they expanded it, and we ended up, I think, with 3 exam rooms in there. And so we were busier and busier, but it was a drop in the bucket. About the same time, our past president's meeting, which we held every year for our Grand Rapids Lions Club, and led by Rick Walker, he said, how do we make an impact in the community? He said, what do we need to do? And we had already decided that vision was where we wanted to make an impact. Rather than just trying to pay for a pair of glasses here that was requested and a pair here, and we did maybe 50 of those a year, the need was greater as you see the numbers. So working with Cherry Health, they challenged us. They said, well, if you raise $50,000, we will name the new clinic that was going to be heart of the city, the clinic part of it, the eye clinic part, we'll name it the Grand Rapids Lions Vision Clinic. So we said, sure. So we did some fundraising and found out that there was other grants available that would roll over. We raised money. We had money from Lions Clubs International Foundation, which we fund every year. And that our goal of $50,000 ended up to be $820,000. Okay, which helped them equip that facility and do what they're doing now that we've equipped it more, we've done more, but you can see the ongoing needs. We've helped build it, but the needs are growing, and we need to keep supporting it. We need to not just say, oh, it's there doing a good job. We don't need the help anymore. You need the help.
We do need the help.
We need the funding to pay for those that are not reimbursable, that can't afford the $40 copay, whatever it is, or they're homeless. They can't afford anything. So our club pays for that. So supporting the event to raise some money and all of this, we still need to have some dedicated events to help raise money, just like we do with ABVI. So we've got our 2 great vision suppliers here in, not suppliers, but entities in the city that we have to support because that's our mission. So it's, so thinking about Lillian, Kelzinski, who did a great job in her leadership and was a Lion also. And then Renee Micah took over, did a phenomenal job, was a Lion, and then graduated on. And now we've had Meagan here. I'm very glad to have you in charge. And I know the shoes were bigger than you thought that you're gonna have to fill. But thanks for all you do, and keep pushing us.
Yeah, no problem. Yes, I was lucky to have two great mentors recently be in this role, so. Yes, thank you for your support, and in addition to that, we, despite having a wait time as an agency, did see a dip in our patient numbers as far as patients served after COVID, so. If you come across people that are in need of any of our services, please send them our way. We need the patients. A lot of the patients that dropped off after COVID, we don't think are getting care anywhere, unfortunately, so. We're trying to re-engage, and this is across the company, not necessarily specific division, but again, we have everything pretty much, including a major discounts on prescription medications, which is a huge issue for patients. So if you run across people in need of medical, dental, vision care, counseling, psychiatry, we can take care of them. Okay, that's all.
Hold on, Megan. Not that, you need reminding, but
Okay.
thanks for being a speaker today.
No problem.
With that, gonna get you out of here 14 minutes early.
Next meeting's October 15th, guest day. Bring your kids.
Good job.
What's the stuff around?